We have another 3 pitches left until the lunch break, so please join us. It's really, really interesting in here. Florian, according to my schedule, you're the next one. Thank you for coming, and please join us again, and let our staff prepare the lunch. Please join us in the hall. Thank you.
Your Excellencies, honorable audience and participants. My name is Florian Klinger. Thank you very much for the opportunity to introduce to you our preventive care for rural communities. I started with social impact projects since 1987. I was among the first in the world to develop biometric identification documents. Since 2000, I have implemented projects in Cote d'Ivoire in heterogeneous domains, starting with biometric driver license, continue with palm oil transformation factory, and 372 megawatt power plant. What made me to focus in Cote d'Ivoire, it was the perception that there are problems that the modern technologies in Israel and from the rest of the world have the solution for them. But if it is something that caught my attention, is the number of young people who are die unexpectedly. I learned that pathologies such as obesity, diabetes, cardiovascular, and respiratory disease are the cause of the death. Those pathologies are called non-communicable disease, in short NCD. They can be detected in their preliminary stage and treated before degradation to chronic disease. We would like to be part of the global solution to reduce this premature mortality due to our prevention care platforms and guidelines. Cote d'Ivoire is an economic powerhouse in West Africa, with an average growth of 8% per year. It's estimated that 37% of deaths are due to those non-communicable diseases. The government don't have adequate means to combat those pathologies. For most Ivorians, the access to health services remains limited due to its high cost. 47% of the population is below the poverty line. One doctor is available per 10,000 inhabitants. Our solution comprises a combination of social approach and the way that technology of prevention care and monitoring is delivered to rural communities. Our innovation consists in creation of self-employed profession called community health worker. Community health workers will become the ambassadors of prevention technologies in their community. They speak their local dialect and they alert to prevent pathologies. Due to the proximity care services provided by our platform and the local community health workers, the rural population will enjoy affordable prices for the examinations, diagnostic services, and prevention guidelines. Our solution is stimulating the spirit of crowdfunding to encourage sponsorship for those in need for financial support. Our first target are the community leaders. We observe that population are receptive to prevention care action when those are introduced by their leaders in local dialect and they are serving as personal example. A great market are social organizations such syndicates, federation, big cacao enterprises that employ hundreds of thousands of farmers. For them, healthy community mean win-win investment for healthy work environment. We are targeting doctors, health organizations, and health specialists to join our platform to propose their services to our ecosystem. We can provide to medical universities database pathologies to conduct decentralized treatment surveys. Government and important market, it's an important market since it is in their interest to subsidize preventive care examination and wellness guidelines and save money on chronic disease burden. We are not replacing hospitals or clinics. You are promoting preventive care to avoid to maximum to arrive to those facilities. Due to our households care monitoring procedures by community health workers, we are migrating from episodic reactive care to proactive continuous care. Our solution and approach fundamentally change the cost-quality equation of healthcare. We are providing digital diagnostic toolkits and history of health conditions of the community members for detecting regional pathology trends. Our platform connects communities with specialists around the world 24 hours a day, 7 days a week for live consultations. The purpose of the funds is to spin the wheel, creating motivation impact to prevent and manage personal health. With 200 diagnostic kits, we can execute about 2 million diagnostic tests per year and create 400 direct jobs. Money will permit to execute and document the pilot test via national TV channels, radio, newspapers, and internet social media. We will use those funds for conducting nationwide seminars and conferences to promote our platform. We will develop and install our multi-dialect help center and call center. The funds will permit adaptation of system integration with new technology around the world. We don't want to approach insurance company. We want to achieve a large population ecosystem. Our value is the ecosystem. Our resellers are social organizations. We can prove that our preventive care services are an added value to their community services. With our affordable prices, they can add their commission for logistics and organization of examination sessions. We will approach NGOs and donors to use the platform for the public for prevention care services. The marketing efforts concentrates to raise the awareness to proactive self-preventive care. We'll conduct intensive mediatization and testimonials and interviews with community leaders and influent public opinion presenters to bring new customers from all West Africa and the rest of the world. We will prove to enterprises, government, that is in their interest to finance and reward those who adopt and preserve healthy guidelines, since it is a win-win approach for them. Healthy people means better lifestyle and increased socioeconomic efficiency. The financial projections are on first level of Vital Sign digital diagnostic toolkit. Based on our previous test, €7 per year is the price that a low-level income person can afford for a basic preventive care examination. Our calculations are based on 10 minutes per test and requires 2 operators per kit. Our goal is to run 2 million checkups per year within 2 years after the promotional test pilot. We estimate to create 400 jobs for 2 million checkups per year, and we predict a growth of 20% per year. We can prove to healthier we can improve to healthier lifestyle behavior and teaching to listen to our body. We have signed a letter of intent with two federations, in total 16,000 examination tests programmed to start by the end of the year. We expect to achieve 200,000 examinations in the first year of promotional pilot test. We would like to achieve financial close by end of the year. I almost finished. Our value are the people, and this team invests time and efforts in this initiative since they believe in the project. Those partners participated voluntarily to set up the platform, and they shared the idea that to prevent is to heal. Thank you very much.